All right, great. So let's see. We had okay, let's see here. All right. So we got some people coming in here, which is great. We're just going to give people a minute or two to join. I feel like an influencer every time I say that, but I'm not that fancy. We're just still going to give people a couple of minutes to join. I know we have a couple of people that are registered, both as intended parents that reach out to me, but also potential surrogates, which is very exciting to have on this
Oh,
call.
very
And
cool.
yeah, that's amazing, and that's why it's so amazing to have you, show here. We'll introduce show later, and of course Joey as well. But it's going to be a lovely session. I know a lot of you are also watching this recording afterwards. We're going to share contact information in the end. If you do have any questions after watching this recording, like don't hesitate to shoot an email to me or show or Joey. I'm assuming is equally open to that.
Sure.
To have a chat or to just ask any questions you might have if you're not here today. I'm going to start a little bit and then we can have people kind of come in as they want to. I'll just say for the people that are actually here live, if you do look at your screen, there should be a Q&A button somewhere on that screen. It's a bit different if you're on your phone, tablet, or whatever, but please feel free to press that and ask us questions during this presentation anytime that you want. So we'll get to those in the end. But don't hesitate. And it's anonymous. Only we can see who's writing and what is being written. So feel free to take the chance to ask all of your burning questions during this session today. And while we do that, I will basically just share this little screen here so we can get going. And I will not say how much I love these pictures because I do that every webinar. So I'm sure everybody that's seen this on YouTube several times will hear the same introduction. So I'll do something differently today and just say that these are lovely. And I'll leave it at that. And you can see the other YouTube videos of how much we love the intended parent journeys and these lovely pictures of, how these journeys pan out and these amazing surrogates and intended parents that are a part of that. Let's talk about today's schedule a little bit. So we're going to do a short introduction, talk shortly about Hatch and PFCLA. We're also going to talk about counseling with Joey, of course. Joey will do that part to kind of introduce himself and what he and his team does. We'll talk a little bit about why emotional preparation is the key, right? That's the topic of this webinar, which might seem kind of like a weird question to ask, but it is, which Joey will go through a very emotional journey in many ways. I think a lot of people are not prepared for that emotional ride, either as intended parents or maybe as surrogates. Show can speak more to that later. But we'll go through why it is important to prepare, but also what are you preparing for, right? Also, how do you prepare for that? We will go through a little bit of the American Society of Reproductive Medicine, their guidelines for this. Not too much though, but they do have some guidelines. We'll just highlight a little bit. We'll talk about counseling with Joey and associates, how that works when you have a counseling session with Joey or somebody from his team. We're going to share a couple of resources that Joey has kindly forwarded to us and usually does share with his patients or clients or IPs. And then we will hear from Shoshana, who is amazing in many ways. She is a four-time surrogate and also the director of surrogate community here at Hatch. Equally exciting to have you on here show every time. So we're going to hear from Shoshana, talk about advice for emotional preparedness, the emotional side of things, both for intended parents, but also for potential surrogates, which I think is equally interesting, of course. All right, so that's today's schedule. And today's hosts, obviously me, Joey, and Show here. Quickly about me, I'm the international manager here at Hatch, which is our agency, of course. We also have our own in-house IVF clinic called the Pacific Fertility Center, LA, which is very long to say, so we say PFCLA in the end. I'm also a father, more importantly, through surrogacy and egg donation. I am an international intended parent, so not domestic to the US. Gone through two of those journeys as a European, if I put it that way. So that's a little bit about me. Joey, do you want to say something short about you now and then kind of talk more about your team, etc. later?
Sure. So good morning, everyone. Good evening or good afternoon, wherever you're at. So my name is Joey Guzman Cafo, and as you see on the slide, I'm a licensed marriage and family therapist. And I have a group practice, Counseling with Joey and Associates. We dedicate ourselves to helping people prepare for the surrogacy, egg donation journey, whatever your family building journey may look like. And importantly for me too is, I'm also a dad through surrogacy. So just like Evan, I've been a father through surrogacy twice. And both my journeys look very different. And I learned a lot about my own, through my own journey, And that's why I wanted to focus on helping people on the psychological side or the emotional aspect side of things, because there's things that I felt that were missing through, my own consultation that could have prepared me further for the journey. And so that's a little bit about me.
Perfect. And I absolutely think that's resonates well with me as well. That preparation was absolutely lacking in my first journey as well. So that's excellent. Sho, how about you?
Yes, I'm Sho. I'm a 4 times previous surrogate. I'm also a mom of 4, and I've been here at Hatch for 15 years and counting. I've worked pretty much every role except for finance, and surrogacy is absolutely my passion, just like my own family is my passion. Being able to give this back to other people, that just makes my world. So I'm so excited to be here and to share about the process today. And I think the mental health component of it is so critical. So this is going to be very helpful information for everybody.
Awesome. All right, thanks for that. Um, all right, so we're just going to briefly introduce Hatch and PFCLA, just so you know who we're kind of talking to today. Hatch has been around for a very long time. Sho, you're one of the veterans here for sure, so you should probably be doing the introductions. I've been here for less time. But Hatch is actually the first egg donor agency in the US, which is amazing, and one of the first surrogacy agencies as well. Like I mentioned before, a couple of years ago, we decided to actually merge together with Pacific Fertility Center to create kind of like an all-inclusive program for everything that has to do with surrogacy or with IVF, the very important part of that journey. So we created something amazing called the Peace of Mind program at that time. The whole idea behind the Peace of Mind program was to really make this a more cohesive journey with kind of everything under one roof, if you will, even though some parts we rely on third-party attorneys, for example, but still having that kind of one structure on the one in one place. We also wanted to be able to give more transparency in pricing. Anybody that's gone through surrogacy absolutely knows that that is one of the toughest part in the beginning, initially understanding what cost am I facing and what is going to be the implications of that long term or short term. But also medically, very important is that when you have your own clinics, we have our own doctors in house. So I know, Sho, you've been involved in these parts in many ways, being able to do some of the preliminary screenings earlier in the process. So looking at medical records review, for example, with the medical doctor, doing a uterus lining check for our surrogates before we accept them, ensuring the safety of both the surrogates and the intended parents and children, of course. So that's what we kind of created with the Peace of Mind program, so that one team experience under one roof. We have fixed fee pricing for all of that, just to make that more transparent and predictable. And we have our amazing doctors that we can draw experience from. So this is just a little bit of how we kind of organize ourselves for you, looking at different options. And not one option is the best option for you. You have to explore, look at different options. This will suit some people. Other options are better for others. So it's all about education. So get out there and educate yourselves before jumping into surrogacy or egg donation for that matter. And this is just a little bit of background on Hatch. We mentioned a couple of these things, our years of experience. We have clients from all over the world, which makes my job as the international manager very exciting to speak to people from all around the globe. We have 3,300 healthy births as the start. Success rates can be a bit deceptive. They don't look at timelines or embryo transfers on the agency side, but they do look at births more or less. So you should always ask a little bit about what's covered there. And what I think is super impressive, starting here 4 to 5 years ago, is that all of the staff is experienced with surrogacy or, being intended parents or surrogates. So Sho is one of many, many, many amazing women that work at Hatch that have actually been surrogates. So we want that balance, guidance between professionalism, humanitarian touch, understanding the journey from the inside. So I think that's a good combination. So that's a little bit about Hatch and PFCLA, so you know who we are here initially. Joey, tell us a little bit about your practice and what you do with your lovely team there on this little nice picture there.
Thanks. So again, counseling with Joey and Associates, it's a group practice. It was developed after, my surrogacy journey, or actually in conjunction with my surrogacy journey. Like I said before, learning what my own experience was with, the mental health provider that I met with and what the consultation consisted of. I felt there were some things that could have helped me further prepare for the journey. And that's how Counseling with Joey and Associates was born. Very uniquely in my team, all of us have our own fertility journey. So again, I've been a 2-time dad through surrogacy. My spouse, who is the office manager, is also 2-time dad through surrogacy. And we have therapists who have been gestational surrogates themselves, and others who have had other type of fertility experiences, in building their family. And so everyone on our team has some type of tie to family building in a unique way. And so we want to be able to support others who are finding alternative ways of building their family. And so that is where we come in to kind of come in and help and support those that need that guidance. And so Counseling with Joey offers, intended parent consultations. We also facilitate gestational carrier, sperm donor, egg donor evaluations, consultation with people who want to donate their embryos to other recipient parents, support sessions for surrogates, support sessions for intended parents. We try to do a lot so that we can support the community that needs this type of resource or support.
Amazing. And once again, something I really would have loved to have in the first journey. Like you said yourself, Joey. So I think it's amazing job that you do, just like guiding people through this, not during, which I'm sure you can also do excellently, but also like before jumping into this very special journey. So that's amazing. And I love that you work with your spouse. That's also cool, I think. All right.
Yeah.
Okay, so why is emotional preparedness key? So Joey, I will leave this over to you to kind of walk us through a little bit about why do we need to prepare emotionally and kind of when considering surrogacy.
Yeah, we might not think of it like, why do we need to prepare emotionally for something? Because not everyone who is able to have children on their own have to go through so much emotional preparation. But when we are building our families through alternative methods, it's important to consider all of the things that we might be faced with so that we can prepare for any pitfalls, anything that might cause emotional distress. We're also working with a lot of people. There's surrogacy agencies, there's medical doctors, there's surrogates, egg donors. There's just so many people involved. And so we want to be able to understand what it all means emotionally when we're dealing with so many people. Part of the emotional preparation is also just being aware of what the emotional aspects might be for those that are helping us, like the gestational carrier or the donors. And so emotional preparation is so important because you want to also understand how you might feel when you're going through the journey, what your experience might be, what those emotions might lead you to, and you want to understand how can I cope with these what if scenarios. um, I have to say that in my journey, there were things that were provided to me that allowed me to understand, okay, this is something that I might experience. So I'm aware of that. So it's not gonna like blindside me. But there were other things that were not provided to me that totally blindsided me. And I was like, oh my gosh, like how do I deal with this? Like I never considered this. I didn't even talk to my spouse about this. And so part of the emotional preparation is also understanding, if you're doing this with building your family through surrogacy, egg donation, sperm donation, whatever the route might be with a partner, understanding how that's also going to affect your relationship. And so there's a lot that goes into emotional preparation. And there's so many decisions that you have to make when you're going through the surrogacy journey. And so you want to consider what all of these choices that you have, like what does that mean for you? What does that mean for your spouse if you're doing this again with a spouse or a significant other? And overall, like how do you prepare emotionally for what may come when you do have a child, all the questions that might come in the future? Like we want to just be able to give you enough information to have that preparedness to deal with situations that you may be confronted with. And so when you're going to be building your family through these alternative methods, meeting with the mental health provider is so important so that that mental health provider can help you, navigate all of the uncertainties that go along with this process through surrogacy or any type of, again, any alternative method that you're using to build your family. You want to understand what those pitfalls might be just so that you can be prepared so that you're not blindsided. It doesn't mean that it's going to take away the emotions that you might experience, but you might be able to navigate those emotions in a much healthier way, because again, you've considered it, you've talked about it, you've processed it, so you have some type of preparation to deal with those things if you are confronted with the hard things that might come with surrogacy.
Absolutely. And I think one of the big points that you kind of talked to me about before kind of preparing for the webinar was giving up control. And I think that's something that a lot of people might not kind of dive deep enough into doing that, because it is scary. And we're not only giving up control of anything, of a very, very important, obviously, thing and very emotional thing. So I just know, listening to you talking about that, I think it's such a great point of, understanding that you are giving up control of one of the biggest journeys in your life to some extent, to your gestational carrier or your agency or legal team, and just handling that is something I didn't really reflect a lot upon as a person that loves being in control. I think that's a great point. Actually, when you said, I was like, yes, that should have been me a couple of years ago, understanding that. So that's a great point. Any of these other points here that you want to just like spend a minute on talking about before we move on?
Well, again, as you guys can see here on the slides, the future is unknown. So you might not have thought about long-term considerations as you're focused, on what is right in front of you. And that's why when you meet with a mental health provider, that mental health provider is going to start to key you in on like, what does it look like in the future when you're making all of the decisions that are right in front of you right now, all the considerations that you should be thinking about, because all the decisions that we make right now about what our family is going to look like is going to impact us and the children as we move along in the future. You definitely, you mentioned the part about control, that which we did talk about before. There is a part that when you come into this process, you may not know that you're giving up control. And so emotionally preparing for that, what that might be like to understand that a wonderful person who's going to be carrying our child might not be within proximity. They may be in a different state, and that might bring up a lot of anxiety. And understanding what it's like to, give up that control, and how do we focus, on the things that we can control so that our anxiety levels can, be decreased, so that also the anxieties that we're experiencing and letting control isn't affecting the person that's helping us in having our child, right? The surrogate. And sometimes when we have anxieties about not having control, our defenses might want to micromanage things, and that might not lead to a very good outcome in terms of the relationship with the gestational carrier. So again, giving up control can be scary, and so you're putting trust in someone else, without considering your emotions, and how might that negatively impact the journey. So understanding those pieces, and in one of the messages here, it takes a village. It does. It takes a lot of people to come together to make the reality of our dreams, which is to become parents. And so we want to understand what it's like to work with so many different people, and how it also kind of intrusive it could be for us in terms of everybody, being involved in the journey and asking so many personal questions. And not only are you, giving up control, but also like how much of your personal information also you're sharing with so many different people. And sometimes that can be something that can be unnerving for people.
Yeah.
This is a complex process. And so we want to understand again, what those complexities are, so that we can focus on the things that we can control that will make us feel better, and just understanding overall what the journey might look like, so that we can have hopefully a very smooth and healthy ride.
Perfect. I think that's the great overview of kind of like, why to consider getting really emotionally prepared. So thanks for that. That's perfect. So how do we do that then? If you put it that way, how do we emotionally prepare actually in theory, like in practice? I'm going to let you talk a little bit more about this. Just wanted to kind of use this text or quote here from the American Society of Reproductive Medicine. I'll leave the long description there for you who do not know what ASRM is, to just have a little read there. For us that are not in the US, for example, might be a bit unknown. But just like we've talked about, even the American Society of Reproductive Medicine looks at and acknowledges that using a gestational carrier is a complex process, right? Just like we talked about. And that there is benefits of doing a psychosocial education, for example, in the aid to kind of decide if you're going to go down that path or not. Which is obviously something that I hope most people now realize that Joey and his team do offer, for example. This is the guidelines from actually just cut out of the American Society of Reproductive Medicine guidelines. We're not going to go through all of them. As you can see, they're very long. But why I wanted to include them is to once again give kind of this nuance to how complex the journey actually is. When they go through, what should that include for intended parents? This is a lot. And I love the point that Joey, you just made about giving up your privacy, right? Something that we as maybe agencies or, working in this field might sometimes maybe take a little bit for granted. It's a big thing for intended parents, of course, or surrogates to do that. So I think just wanted to keep this kind of, or have this in this presentation to kind of give that sense of how much there is to explore. And that guideline actually says that a clinical interview should cover at least these things. But I know there's much more that you do cover during a call. So walk us through a little bit, Joey. What do you do during a counseling session with you, which is one way to obviously prepare for this according to the guidelines? What do you go through? How does that meeting look? So people know a little bit more about that before they eventually jump into that conversation.
Yeah. So first of all, when you probably don't know this, but when you're going through a surrogacy or third party reproduction, assisted reproduction, your agency or fertility clinic is going to require you to undergo something called an intended parent psychoeducational consultation. And what that is, it is a meeting between you, the intended parent, and someone like myself, a mental health provider. And it's gonna consist of reviewing all of the different topics that are important for you to review to prepare for the surrogacy journey or the assisted reproduction, journey. There's a lot of topics that you will go over with the mental health provider. And a lot of them come from the ASRM guidelines, the things that should be discussed to emotionally prepare someone for that journey. To begin with, it's going to give you an overall understanding of what the process is, and understanding how do you emotionally prepare for the journey. And that goes back to understanding what your decisions are. So when you meet with a mental health provider, you're going to understand the different types of donors, because a lot of people don't understand that. And what does it mean in terms of someone who is an identified donor versus a non-identified donor, or a donor who is non-identified, but there is, open identity release. These are terms that not everybody understands, but when you meet with a mental health provider, the hope is that they're going over this with you so that when you're, trying to make a decision about how do you select a donor, you have these terms, you have someone who is going over what does it mean for you, and also what are the emotional aspects of when you choose these different types of donors, and what does it mean, what are the implications for you in the future and your children. So again, it's about understanding, these specific things. How do you choose a gestational carrier? What are you looking for? So expectations, what do you want the journey to look like? What type of relationships, do you want to have with the people that are helping you build your family, that be the donors or the gestational carriers? A lot of the times, the relationship with the gestational carriers is one that can be very, long lasting. And so it's important to understand, again, what do you want those relationships to look like? There's going to be a lot of psychoeducation that's going to be provided to you during that meeting. There's going to be things that you're going to review that you didn't think, you had to consider. You're definitely going to review things like communication and boundaries, again, with the surrogate, tying back to the relationship. What does the communication look like? How often do you communicate, throughout the journey? What type of boundaries should you be having so that you're not, impacting the relationship? What type of relationship will your child have with the gestational carrier or the donor? What does disclosure look like? How are you going to share information to your child about them being donor conceived and being born through surrogacy? And what is the overall family dynamics, in terms of, the roles that everybody will play, with your child? Support is very important to have overall. So understanding, what your support system looks like, the coping skills that you can utilize. And if you don't have coping skills, the mental health provider will help you develop some coping skills that you can use throughout the journey to reduce any stressors for you. And you'll be talking about a lot of difficult, subjects like termination of pregnancy and what that might look like for you if you're confronted with that, what that might look like for the gestational carrier. So there's a lot of different topics. And I know right now in these slides, there are a couple of things that are pointing out, but there's a lot more that goes into that, intended parent psychoeducational consultation. Just to give you an idea, we highlighted some of the things here, but overall, it's really about understanding, the overall process, and trying to emotionally prepare for the unexpected.
Yeah.
Now, when it comes to the gestational carrier, gestational carriers go through an evaluation process and some implications counseling. And for them, it's also about, understanding the overall process. So when we're meeting with them, we're trying to understand what their motivation is for wanting to become a gestational carrier. We want to understand, do they have informed consent? Do they understand what they're getting themselves into? We also want to, discuss what the expectations are. What do they understand about the expectations of being a gestational carrier? We want to go over what the expectations are regarding the journey, what the expectations are around the intended parents. Sometimes, there are people that want to help specific types of people. So we want to understand, are you open to helping all types of intended parents, or are you focused on helping a specific population? What type of relationship does the gestational carrier want to have with the intended parents? Just like the intended parents with the gestational carrier, same thing. What type of communication are they looking for? What type of support does this gestational carrier have? They are taking on a huge responsibility, and this could be emotionally impactful for them. So we want to make sure that they have considered, what their support system might look like. Who are those people that are going to be there for her throughout the journey? We want to talk about, what the emotional, psychological, social implications are. What does this mean getting into this surrogacy journey? If you're confronted with difficult things, like how would you navigate this? What does this mean for you? What are the coping skills that you can utilize for this process? And socially also, surrogates can be confronted with things, people that don't understand surrogacy, that might, look down upon, surrogacy. And so we want to make sure that, they are aware that this could be something that they may be confronted with, specifically depending on where they live in the United States. Surrogacy may be frowned upon more in certain, parts of the US compared to others. And so we want to make sure that you have considered all of these things. We definitely want to review mental health history, because that is really important. We want to make sure that someone is emotionally and psychologically prepared to take on this huge task of helping someone build a family, because surrogacy is very emotionally demanding of someone. Termination of pregnancy is a huge one. We want to make sure that you understand what this means, because the surrogate also gives up control in this process. There's a lot of aspects that she will not be able to control, that, they're decisions that are dependent on the intended parent. And so we want to make sure, are you prepared for this? Like, have you considered this? What might this look like for you? Because it's not going to be easy, because the surrogate's pregnancy experience with her own biological children will differ from the gestational carrier pregnancy, even though there's similarities, but there are also some differences that are very important to consider. There's a lot of psychoeducation that's provided during that evaluation. So again, the surrogate can make informed decisions and provide informed consent. Again, we've highlighted some of the things that we go over. All of these topics are things that are recommended by the American Society for Reproductive, the ASRM guidelines. They have considered all of these things. They have provided these guidelines for us to follow. And there's a lot more that goes into these conversations, but these are some things that are highlighted.
Yeah, exactly. I think that's great to pinpoint. It's not an exhaustive list. Like, this is exactly what you have to speak about. And I'm sure that, Joey, during your calls, that people bring their own, baggage. I was going to say, it sounds so negative, but they bring their own experience, bring their own questions. So I'm sure it varies from call to call, and that it's very personalized in that sense.
Yes. And so again, while we review all of these things, there is the question part. We definitely want to answer, the surrogates' questions, the intended parents' questions, their concerns. We give space for them to be able to ask questions, again, so that they can have those questions answered and feel better about the decisions that they're making.
Perfect. Wonderful. Thanks so much for walking us through how that call works, more or less, at least. And you have a couple of resources here that you wanted to share. I think I'm going to leave it to our lovely audience, or those watching this recording or on YouTube, to look into this a little bit. But do you want to spend like a second just like talking about any of these in particular? Obviously, they're all great because you've kind of collected them here. Anything you want to point out here before we let people do their own research on these?
Yeah, I mean, there's so many different research. These are some research that we put out there, for gay men or same-sex couples who want to, build their family through surrogacy. There's men having babies. There's Gays with Kids. Gays with Kids has a GWK Academy that also provides information on how you get started if you want to build your family through surrogacy. The ASRM, Society for Ethics in Egg Donation and Surrogacy. These are some great places where you can start to see where do you find providers and what are the recommendations. Resolve is also a great one for everyone. Resolve is a national organization that brings awareness to everything related to infertility and surrogacy and every other way of building a family. And they have great resources and tutorials and support groups that you can utilize, that can be helpful as you're navigating your own family building journey.
Wonderful. Perfect. So I'll give people a chance to look into that, and I recommend doing that as well. Resolve is actually a bit unknown to me, so thank you for educating me as well, already from the inside. But all these other ones are also lovely and know them a bit better. Perfect. All right. Well, now I want to hear a little bit from you, Sho, about all the advice you can give us on this very important topic of emotional preparedness. Obviously we're limited on time, and I'm sure we could talk about this forever. But walk us through a couple of the things from your perspective, not only as a 4-time surrogate, but also Hatch's director of surrogate community, as a mother of your own kids, of course, just some advice on that, from whatever perspective you think is important. And I'll let you start off with this amazing slide and tell us what we're looking at here.
Yeah, so Hatch, we call ourselves a surrogate powered program. And that's because we are essentially a program that is by surrogates for surrogates. Every single one of us working surrogate facing roles, we've all been surrogates ourselves. I'm not even our record holder. Actually, I've done 4 journeys, but our record holder is Becky, who has done 5 journeys, which is pretty incredible, including caring for the same family more than once. I've cared for 4 really different families myself, and everyone on our team brings a different experience to the table. Some of us have been surrogates through Hatch, like myself, all my journeys were with Hatch, but we also have people on our team who've done independent journeys and people who have been with a number of different programs. So the knowledge base is very diverse, and that really shapes how we do our program and how we think about surrogacy. So if you go to the next slide for me, for Edwin.
Absolutely.
There you go. Thank you. All right. So in surrogacy and really in life, I'm a big proponent that mental health is health. So your mental health and your emotional well-being impacts your surrogate. So speaking strictly to the intended parents here, I think from a surrogate's perspective, I know that my journeys went better because my intended parents met with a therapist, had done the work before starting their journeys to be in the right mindset to proceed. It makes a huge difference. And I remember talking to my first intended mom and asking her, very gently, how she felt about all of this, going through it, like what that was like for her, watching somebody else carry her child, knowing that she had wanted to do that herself. And she told me very wisely that she'd spent so many years, processing that before turning to surrogacy, grieving that it wasn't going to look the way she thought it was going to look, and making her peace with it so that this journey was just pure excitement for her. When we achieved a pregnancy, when the pregnancy was going smoothly, there was no longer that sense of loss for her anymore, just that joy that she was closer to holding her baby. And I thought that was incredible. I couldn't even imagine how many years it would have taken me personally to get to that same length of wisdom that she had achieved. But it spoke to me because I think that really shaped our experience. And I've seen the journeys that are harder when, parents haven't taken those steps sometimes, or maybe haven't dived as deeply as they needed to, and are still grieving while going through a pregnancy, and how not only does it take a toll on the intended parents, but also on their surrogate, because the parents can't get quite as excited, or they are more nervous, or they haven't quite surrendered that sense of control that we all know is not there. There really is nothing that can be controlled, from an intended parent's perspective, other than who you choose to work with. That's really kind of the extent of it here. It makes a huge difference when someone's in the right mindset before getting started in setting up a positive journey. And this is a process that is based in mutual trust, and that trust is needed to build a positive connection. You can't really get to trust unless you've done sort of the work on yourself first to understand what you're stepping into, what this is going to look like. And I like to give this perspective from a surrogate IP on both sides. So intended parents, you're trusting your surrogate with the most important 9 months of your child's life developmentally. That's huge. I don't want to discount that in any way. A surrogate is trusting you with that child they carry for you for a lifetime. So it's huge on both sides what you're trusting the other with. You have to go into it with that mutual trust or respect. There's really no other foundation you can build off of. And that can be challenging, again, if you haven't spent the time really wrapping your mind around the process before getting started and getting really good guidance. The journey also takes really honest, open, supportive communication. That's key to having things go smoothly. And I can say that, throw this one to Joey and throw this one to Edvin, but did you ever run into bumps in the road on your journeys? Anything that came up you didn't expected?
Absolutely.
Yeah, me too. Me too. You know, you go into it thinking it's going to go one way, and sometimes it doesn't. Sometimes it takes more than one transfer. Sometimes there are losses that happen that are very sad when they happen. Sometimes there are complications of pregnancy with bed rest. Sometimes the birth doesn't go how you expected it was going to go. There are so many things that can come up along the way. But if you've built great communication and you're supportive of one another, you can really get through those things, really get through anything that happens as a team. And this is such a team process. And the team isn't just you and your surrogate. This does take a village, like Joey said. So it's you, it's your surrogate, but it's also your agency. It's your therapist. It's the surrogate's therapist if she has one as well. It's the attorneys that each of you have chosen to work with. It's the doctor that you're working with. It's the OB that you'll have for the pregnancy. It's every person that touches your case along the way is a part of your village, and building a great village goes a long way. And then surrogates, I like to always make sure intended parents remember this. It's so important that surrogates are first and foremost, they're moms to their own kids. That's why you're choosing them. They already know what it means to be a parent. They poured into their own babies, into their own now kids, you know, and to do all the right things so that you can trust them to do the same for your child. But they need that understanding from their intended parents that they are balancing during this journey. They are juggling their own families, their own jobs, their own lives, sometimes their own education, even at the same time. And so they have to maintain a number of things as they go through the journey. So having that realistic expectation of what time is she able to commit to communication? What does that communication look like? Will you be able to go to appointments together? Will she have to plan them around, you know, her work schedule? I think it goes a long way when the parents can see their surrogate as a whole person with a whole life and not just as their surrogate, because surrogates definitely see the intended parents as whole people and the lives that they're going to provide for the child that they're going to welcome into the world. So this is more than just a relationship built on and around the pregnancy. You get to know each other. There's an opportunity for a very unique friendship here. And I was so grateful that I built that with my parents. Again, it got us through when hard things came up, that I knew a little bit more about them, that it wasn't just the one interaction where we had to talk about a hard decision about testing that they may or may not have wanted to do, or what the birth plan was going to look like. If you don't have that foundation and you have to have more sensitive conversations, it can be incredibly difficult. And then I like to emphasize that surrogates directly connect the way intended parents treat them with how they're going to treat their own family. So Joey talked a lot about thinking for the future. This isn't just about getting pregnant and having a baby. This is about raising a child. And so there are a lot of considerations for the future. And if you've thought that far ahead, your surrogate is going to feel that in the journey with you. They're going to know that you're thinking about not just how cute a baby is going to be, but what it's going to be like to raise a child all the way through to adulthood, and even shepherd them in adulthood, because any of us who've become parents here, like, when does it end? Does it ever? Right? I mean, I've got one who is going to be 18 this year. I feel like that deserves a parenting merit badge. I got one through almost 18. I'm really proud of myself right now. And then I have one who's 8 months old and two in between. And the needs are so different at different ages. And I was so glad that I did think ahead, even though my first pregnancy was a surprise. I, in those moments, thought ahead to what that looked like. And when I saw that same thing in my intended parents, that this wasn't just having a baby. Babies are adorable. This was about building a family and a life with their family. The way that they treated me, the way that they treated my own kids when they would visit, spoke so much to me and made me so confident that I'd made a great decision in the families I chose to carry for. I'm still in touch with my 4 families today. 2 of my surrogate babies just had birthdays on the 6th. Just funny, years apart, different families, just worked out that way. And I still get pictures and updates, and I just know how cherished they are. I know the amazing lives they have. And it's exactly what I expected based on how I was treated during my journey. So know that, you know, loving on and supporting your surrogate during this journey is showing your surrogate what you're going to do for your child. And that means a lot. So that's the best advice I think I can offer out the gate here. I hope it is helpful, but I'm here for questions.
I'm sure it's helpful 100%. And I think once again, as many intended parents as we meet that, have never ever had the chance to hear a surrogate talk about these things, and these relationships, and have also, nothing against intended parents. We all need to learn, but have these misconceptions about what does communication mean or relationship. Can I even have a relationship with her? Oh, wow, that's amazing. Things you would think everybody knows, absolutely not. So everything is useful. I'm sure we're all in different places of our research, here, but it's always great to hear you talk about this show. So thank you so much for that.
My pleasure.
All right, we do have a couple of questions. We're just going to share this with you. If you do want to reach out to any of us here, we can start at the bottom. Actually, if you want to reach out to Joey and his team, obviously visit your website. It's 2025. There's a website for everything, or email Joey's team there if you want to reach out to Joey and have any questions or want to book an appointment or whatever it might be. If you want to apply and become a surrogate after listening to Shoshana's amazing advice there, you could email Shoshana. I'm sure she's happy to answer more questions. You're always out in the community, Shoshana, as well. So I'm sure you're okay with questions there as well.
Absolutely.
Or visit the Hatch website and apply. It also works. If you're an intended parent and you want to have a chat about, being an intended parent going through this journey, you can email me at edwin@hatch.us, or you can go to our website, even better, to fill out a form there. And if you're very technically advanced, you can use that QR code, but I'm not that kind of person. I would never make it work. But you can go for it. All right, great. I do think we have actually at least 2 questions here that were thrown in during our chat. So let's have a look about that. So I wanted to ask if you have advice for IPs who come to this surrogacy journey having had very traumatic experiences prior, so pregnancy complications, loss, medical trauma, resulting in infertility. I mentioned these as I feel I'm coming with an abundance of panic about every stage to come for the surrogate and also for my future baby. Any advice on staying hopeful when this is the prior experience would be very helpful. And also thanking also Shoshana for the amazing impact that surrogates do make for their intended parents. So what do you say? I think, Joey, I think the first part of that question is great for you to try to answer.
Yeah. Well, first of all, I want to say for the person who asked this question, thank you for asking, and I'm very sorry to hear about the complications and losses that you've experienced. So if you are coming into surrogacy with losses and medical trauma, pregnancy complications, it's going to be important to understand that when you go through surrogacy, there is going to be the possibility of unknowns, and being able to acknowledge, the anxiety that might come up with that. It is okay to be anxious. It's okay to be nervous. And really, because I see that you mentioned that you were working with a therapist, and so being able to have support while you're going through the journey is going to be really important. So being able to have that outlet to be able to talk about what the concerns are, what the anxieties are. So staying, in contact with your support people and allowing yourself to speak on the things that are coming up for you is going to be really important. There isn't going to be anything that's going to eliminate all, anxiety from this journey, but how you handle the anxiety with all of the stuff that you have already experienced, it's going to be important to have an outlet to talk about what you're experiencing. So there isn't there isn't like something that's going to eliminate everything, but if you're coming in with trauma, you want to understand that it's going to be important to have someone to be able to speak to, whether if it's a therapist or a support system. And also hopefully you're able to be kind to yourself, give yourself permission to be kind to yourself when you're going through this journey, because it's already been really hard and difficult for you. It's just giving yourself some grace, and just being kind to yourself as you're moving through surrogacy or just navigating the overall journey. I hope that's helpful.
Yeah,
that was beautifully said, Joey.
It is. And, absolutely understanding that that's a very complex question, which I'm sure the person asking as well realizes and hard to kind of address in a short time. But yeah, thank you so much, Joey. And I was going to encourage, to reach out to Joey if you do have questions of that kind or any other things you need.
I'd love to chime in on this one too, though.
Yeah, sure, go ahead. Yeah, sorry.
Stories like this are why surrogates do this. And I think it's important to be honest with your surrogate. It's great that you have your own support so that she doesn't step in and start to feel like she needs to be a therapist herself, but for her to know your story, getting into it, that just makes her more passionate about making this possible for you. I've cared for families who've been through recurrent miscarriage or complicated pregnancy. And it's exactly one of many, but one of the reasons that I chose to do this, why many surrogates choose to do this. And a surrogate knows that you're a human and you're going to have feelings, and the empathy is a two-way street in this journey. So you do lean on each other a lot in a lot of ways as you go through it. But surrogates understand when they're parents who've been through hard things, if they're honest about their stories, that there are milestones that are sensitive, there are updates that are sensitive, and how to navigate those sensitively. And the other thing I would add is the agency is a huge asset when there are things that are sensitive, because if you're feeling that anxiety and you want to communicate a concern rather than going directly to your surrogate, you can use the agency as a buffer to say, hey, can you check in and see how are things going for her diet and lifestyle? Is she doing okay? Does she need other support in different things? You can do that in a way that doesn't affect your relationship by leaning on the agency.
Yeah, and I also want to just come back to add to Shoshana after your amazing sharing here, is that this goes back to like why it's important to have an internet parent psychoeducational consultation or meeting with a mental health provider, because someone who has experienced trauma before in their own fertility, experience, this conversation that you have with a mental health provider will allow for time for you to explore these past experiences and hopefully they assist you with developing coping skills that you can utilize as you're moving forward with the surrogacy journey.
Absolutely.
Wonderful. Thanks so much for sharing, both of you. And thanks for that question. Very personal, once again, giving up, integrity, personal sharing. Thank you so much for that question. Is there any other question before we say goodbye? We have, especially Joey, want to, get you going in a reasonable time. If you have anything else, shoot now. But if you don't, thanks so much for joining us. If you're watching this recording afterwards, ask us questions, reach out to us. We're happy to connect with you. But I want to thank you both, Joey and Shoshana. I know you're busy and, this is a very important topic, which we don't explore enough, I think, still, even though, you have these guidelines, we have you doing that, Joey, as well. But once again, just having done this myself, not thinking deeply inside of many of these issues, not many, I would say I did some of them, is just a testament to how important it is and how much we need that still within, surrogacy. So thank you both for being here, and it's been great listening to you both. So stay safe, everyone, and connect to us if you need us. All right. Thank you so much.